Wanted to jump on, Sarah Jane here from the Rehab Hub, and talk about Verruca. A question that we get all the time is what Verruca treatment is right for me. We get many people that have had Verrucas for years, some of them over 10 years. And can you, even if you've tried over the counter, even if you've been to other clinics and tried other solutions, but they've not worked, or you've had various different things done, what options are there for you? And there are options. And I want to talk a wee bit about what we do at the Rehab Hub. So I'm Sarah Jane, I am a podiatrist, and we have in the Rehab Hub in Glasgow, we have some solutions to verrucas that you've maybe not heard of. So first line, say for example, kids. We don't want to do anything too invasive quite early on. So usually what we will do is we'll start with a solution that essentially mummifies. It kills off the DNA of the Verruca virus. The Verruca virus is a human papillomavirus. And essentially what we do with this, we have a very strict protocol. So you're coming in, we remove a lot of the virus for you. We have all the instruments, everything's either single use or sterilised. We will treat the Verruca in person, certainly we'll diagnose, make sure it is a Verruca. And then from there, we will put a solution on that essentially mummifies it. We then from there have a strict protocol that we get you to do either to your child or to yourself, and you're putting on a little solution twice a day. And usually we'll say to you to put it on in the morning, put it on in the evening, and that's vitally important so that it essentially helps that mummification of the actual structure, so that we're trying to kill off the DNA of the virus or disrupt it. And then from there is prepping for your next appointment. Usually for that type of procedure, minimum of 3 sessions and a maximum of 6 sessions. So that's option one. Great for kids. It's completely painless. There's maybe a little bit of kind of fear with kids. They think, oh, they're going to do something bad to me. Pretty much won't feel anything, and it's pretty simple and easy. With that solution for us, we get a very, very high success rate from that. However, for some people, it's just not enough. From there, what we would then have the option of is probably more surgical. So what we do is we would do needling to the area. We push the virus into your bloodstream because we need your immune system to essentially help resolve the virus. So what we do is we use a local anaesthetic. We inject a local anaesthetic into your ankle. So you get what's called an ankle, a tibial block, and we numb the plantar aspect of your foot, and that then allows us to do a procedure on your foot. We do Faulkners needling here. In terms of research, it is clinically, it's got the best research out there. However, as we know from this, research is only as good as the research that is out there. So there isn't really a lot of research being done on verrucas because it doesn't pay to do, and it's not something that is life-threatening. It's not going to hurt you. So there isn't tons and tons of research done on it. So, but Verruca needling, or Faulkner's needling, there is a decent body of evidence there, and certainly it can work very, very well. So it's a bit more invasive. We wouldn't recommend that for children. But if you've got maybe a Verruca that just is very, very stubborn and it's not going, then that definitely is an option for you. So as I said, you would get your ankle, basically an ankle. It's not a full ankle block, it's a tibial block, meaning we're not knocking out the full foot. So we're only actually numbing the plantar aspect of the foot, so the bottom of your foot. We then use a sterile needle and we puncture your skin a lot of times, like hundreds of times, and we create lots of little punctures where essentially we're pushing that virus into your bloodstream. We then dress it up, and we usually see you a few days later for a dressing change, and then we then wouldn't see you again for about 6 months, and there's a little package for that. And usually what we would find is most patients phone us up within 4 or 5 months and say that they've all cleared up, they're gone, I don't really need to come back in and see you. Fabulous. And it's very unusual to see someone back and it's not cleared up, but certainly it can happen. Now, In terms of costs, associated costs of treatment, what does that look like? So for Faulkners needling, you're £280. You're only coming in for that one appointment. That's including your local anaesthetic and the whole procedure and everything that you need from that. That also includes your checkup and redressing appointment, and that also includes the appointment in 6 months' time as well. So essentially there's almost 3 appointments in that, very spaced apart, because obviously one's in 6 months' time, and you've got 2 fairly close together. So you're £280 for your Faulkners needling. For your other solution, it's not, we use Verruca in here. We get great success from it. We really, really do. And for each session, you are £60 for your first session for any podiatry treatment for us, any basic podiatry. And then thereafter it's £55. So it just gives you an idea of what the associated costs are. Usually, it just depends. So if you've got a big cluster of verrucas all over your feet, you might use more vials, so you'll be slightly more expensive. Not majorly, you'll be an extra £20 on top of your treatment cost if you're needing more vials. So if you've got lots of them, if you've got multiple ones in both feet or your hands, or so if you need more, that's don't let that stress you. We are currently working with a few people actually who've got massive big clusters all over the plantar aspect, around about the top of the foot. So if you imagine that's a foot all across here, usually you'll get verrucas where you've got pressure, where the skin has been interrupted. So usually around the kind of balls of your feet and round about the heels is the kind of normal places, or maybe your toes if you're a toe scruncher. So we are currently working on some young girls that have got some big clusters that have been to a few different places and had unsuccessful results, and that's just sometimes the luck of the draw with that, or what procedure they've done. They've maybe had salicylic acid, or they've maybe had cryotherapy done. We don't use them here. The evidence base isn't great, although the evidence base isn't great for many of them, but we find that what happens is that it scars the tissue quite a lot. So a lot of people are coming into us and they've had so many caustic things on the skin that the skin is really badly damaged. So we don't do that. It can't mean it's not that they cannot work. Salicylic acid or cryotherapy have their place. It's just not something that we do here. Certainly from Verruca, for how we're using it, it works extremely well. So there are 2 options. So if you are struggling with verrucas, please just use the link in this email, in this video, even if you're watching it on replay, or feel free to message us. You might not want to message publicly on the comments section of this, depending where you're watching, but you're more than welcome to, or just send us a DM if you're concerned. If you're not sure that it is a verruca as well, we want to check that it actually is. It's nothing else. And the best plan for you, some people will come and say, "Oh, just do the needling, just go in and do the Faulkners needling." And actually, what we've done is we've went through a protocol of the first line of Verruca, and it's resolved. We have, I think, the kind of difference. Now, there's no studies been done on this, and it's definitely something that should be done. Is we have a very strict protocol with our treatment. So you might have tried Verruca before and it's not worked. So far for us, there hasn't been a Verruca client that we've had to progress beyond their 6 treatments that we've resolved everybody so far, and that's a big statement to make. Though there will be, I'm pretty sure, soon some people that will prove that wrong. But so far, our success rate is at that 100%. It's maybe just been total luck, because verrucas are, you're relying on that body's immune system. So we do have a very strict protocol, and I think that possibly that's not happening elsewhere. So there's certain things that we need you to do. We need you to help us get it to that point that it's clearing. And if you're motivated enough to get rid of it, you'll do it. It's not difficult. And we give you everything away that you need. So you're leaving with your little package, your home kit that allows you to do what you need to do. We'll not ask you to go elsewhere and go and buy something. You literally will leave with what you need to do. you've got it right there and then. So I think the difference really is just that giving you everything that you need and you understanding how your part in that process of getting your verruca resolved. And then the Faulkners needling, some people just prefer to, they maybe don't have, maybe they're time sensitive, or we've got some people that actually have come to us from down south, so they're only wanting one visit, so they're coming down from, or up from maybe Manchester to be treated, or wherever, Newcastle, we've had a few that have come up, and so they're just want to see us once. So the Faulkners needling actually works quite well. The only thing for that is we would have to work with somebody locally to check your dressing, or we can do a video call to check your dressing as well. So we would give you things away. So if you were doing that and you were travelling from further afield and you didn't want to come in, then we would do a video consultation a few days later, and we would give you your dressings to change it and show you how to. I mean, it's really not difficult, but the main thing is we're checking there's not an infection. That's the biggest risk really for the Faulkners needling, is the risk of infection. The other ones, again, if you're bleeding, there's always a risk of infection. There's a risk of with anything. With Faulkners needling, also you're getting a local anaesthetic, so there's a risk of you having an allergic reaction to local anaesthetic. Apart from that, it really is it's a pretty simple procedure, but it's just a wee bit less nice than the first solution. Please, if you're struggling, do just reach out to us or book in. If your kids are struggling with it, especially just now, we're all out at pools, we want to get our feet out, and if you're embarrassed about your feet, it's something that we absolutely can help with. It's something that we do pride ourselves in helping people resolve. So we would hate to think that people are out there struggling. So if you want to get your verruca resolved and you want a solution that really will help you resolve it, then reach out, ask any questions, book an appointment. I've put the link to the direct booking for this just below this video, so it will be on that as well. And if you have any questions, don't hesitate to ask us. All right, have a good one, and I'll see you later.